guys! Welcome back to Filipina's Wonder channel. And for today's vlog, I will going to state about if a foreigner can have the insurance here in Philippines, a healthcare insurance here in Philippines, and we're gonna state about the problems of the hospitals here, and not only the problems, or if a foreigner can have a benefit just like that. So we're gonna state about that because it is very important to those foreigners who are gonna come here in the Philippines. And I will make sure this video will be a lot of lesson we're gonna learn from this. And yes, I do some research of this video, and I hope you guys will gonna watch this all until the end. So, majority of Filipino people lack access to basic health care. Even before the pandemic started, 16.7% of Filipinos live under the poverty line as per Asian Development Bank. Poverty has prevented millions of Filipinos getting the healthcare services they need. In short, a lot of Filipinos are too poor to go to the hospital and to get the treatment they actually need. Second, there are not enough healthcare workers in the country. 75% of cities and municipalities in the country have an insufficient number of healthcare workers. According to the government think tank, Philippine Institute for Development Studies, PIDS, a lot of healthcare professionals have opted to move abroad for better career opportunities. Those that do choose to stay in the Philippines are more likely to work in areas where earnings are potentially high and near communities where they were trained. The healthcare industry has not embraced digitalization. Amazon Web Services (AWS) said that 99% of healthcare companies in the country still use paper data. The Philippine healthcare system has yet to integrate tools of digitalization such as the cloud and artificial intelligence (AI) to streamline its processes. Thus, procurement of supplies and sharing of data has been quite slow across the country. Provincial hospitals have limited access to medical supplies. It can be challenging for hospitals in rural areas to acquire all the medical equipment and supplies they need to give patients the best care. Hospitals operate with limited budget, and it's important for them to acquire excellent quality products for patients. Unfortunately, quality checks and logistics can prolong the procurement process. To add to this, hospitals in rural areas face logistical challenges. It can be difficult for them to have products shipped to their facilities. Given that the Philippines is an archipelago, the process of shipping medical supplies can be tedious. Can a foreigner get an insurance in Philippines? Yes. The implementing rules and regulation of RA Protected Content, as amended by RA Protected Content, provides for the inclusion to the National Health Insurance Program the citizens of other countries residing and or working in the Philippines. Are expats eligible for PhilHealth? The rule is simple. Expatriates who are employed in the Philippine territory are required to be affiliated with PhilHealth. The monthly contribution rate, currently set at 3.50% in 2021, is shared between the employee and the employer. Expatriates who do not have an employment contract are eligible for PhilHealth if they have residency status in Philippines. The expatriate's family can benefit from the coverage by being declared by the expatriate. So here is the list of care covered by PhilHealth. So as well as the conditions and limits of reimbursement, the price of pharmaceuticals is not excessive. However, you will not be able to buy drugs only by prescription. Also, check if the medications you bring are illegal in the Philippines, as medication is highly regulated. Why do you need to take private health insurance for foreigners in the Philippines? So, have a private health insurance, you access to all health facilities and hospitals. And second is to benefit from faster care and a better quality of care and service, especially if you live in a less well-served rural area. Third, have access to additional medical services and emergency medical assistance available at all times. Why is expatriate health insurance the best coverage option? So unlike travel insurance, expatriate health insurance is intended to cover you in the long term and more comprehensively. You will be covered both in case of emergency and the routine visits. In addition, an expatriate health insurance at the first you replace in all in one role, so up to 100% of the actual cost reimbursed without complementary health or mutual.